As a Syrian physician, I know what it's like for healthcare workers when facilities are under attack. I know the fear, the chaos, and the heartbreaking choices we are forced to make. Attacking hospitals is not just about physical destruction. It's about punishing civilians and causing severe mental, physical, and emotional harm. This harm lasts far beyond the immediate death and injuries caused by an attack, by degrading the healthcare system and obstructing access to healthcare for people who need medical attention, including pregnant people, children, people with disabilities, and people with otherwise easily manageable illnesses. Hospitals are specially protected under the laws of war, but unfortunately, we have documented increasing attacks on healthcare facilities during conflicts around the world. Increasingly, health workers are under fire in Gaza, Syria, Ukraine, Sudan, Myanmar, and beyond. Safeguarding Health in Conflict Coalition reported nearly 2,000 incidents of attacks on healthcare in 2022 globally, and the 2023 trajectory is already set to surpass this number. This year, there have been around 640 confirmed attacks on healthcare facilities in occupied Palestinian territories alone. When hospitals are not safe, people don't seek the care that they need. Hospitals should not be targets. All combatants have to take all precautions to avoid or at least minimize harm to hospitals even during active combat. Attacking healthcare facilities is a war crime. Militarizing healthcare facilities is a war crime. These actions violate the fundamental human right to health, but also the sanctity of humanitarian principles. They must not be allowed to continue with impunity. PHR works with international institutions to defend the norm prohibiting attacks on healthcare around the world, most recently in Ukraine. In the context of Israel and Gaza, we urge all parties to cooperate with the International Criminal Court, which has jurisdiction over the situation in Palestine, as well as the UN's Independent Commission of Inquiry, to establish the facts and move forward accountability for perpetrators and justice for the survivors and victims. Healthcare is not a target. We at Physicians for Human Rights are calling for immediate action to stop attacks on healthcare and to hold perpetrators accountable. We call on all parties involved in conflicts to abide by their obligations under the international humanitarian law and ensure the protection of healthcare workers. Protecting them helps protect everyone.